For the description of the disease, one of the most common eye disorder is the cataract. A cataract is a lens opacity or cloudiness. On visual inspection, the lens appears gray or milky. A cataract is a clouding of the normally clear lens of your eye. A cataract is a dense, cloudy area that is formed in the lens of the eye. A cataract begins when proteins in the eye form clumps that prevent the lens from sending clear images to the retina. The retina works by converting the light that comes through the lens into signals. It sends the signals to the optic nerve, which carries them to the brain. For the causes, we have the cataracts usually develop without any apparent cause. However, they can result from: first, the degenerative changes. Seen in cataracts develop in elderly patients probably because of the degenerative changes in the chemical state of lens proteins. Second is the genetic defects. Congenital cataracts occur in the neonates. Genetic defects or a sequela of maternal infections during the first trimester. The third cause, which is the foreign body injury. Traumatic cataracts occur after a foreign body injures the lens with sufficient force to allow aqueous or vitreous humor to enter the lens capsule and also dislocate the lens. We have the fourth cause of the cataracts, which is the secondary effects. Complicated cataracts occur as secondary effects in patients with uveitis, glaucoma or retinitis pigmentosa, or in the course of a systemic disease such as diabetes, hypoparathyroidism, or atopic dermatitis. The last cause for cataracts is the drug or chemical toxicity. Toxic cataracts result from drug or chemical toxicity with prednisone, ergot alkaloids, linitrophenol, natrapline, phenothiazines, or pilocarpine, or from extended exposure to ultraviolet rays.
Clinical manifestations of cataracts. Painless blurry vision is characteristic of cataracts. Then the person also perceives that surroundings are dimmer, as if their glasses need cleaning. Light scattering is common, and the person experiences reduced contrast sensitivity to glare, and reduced visual acuity. Other effects include myopic shifts, which is the return of ability to do close work, example, reading fine print without eyeglasses, astigmatism, which is the refractive error due to an irregularity in the curvature of the cornea. Then another manifestation might be monocular, which is double vision and color changes as lens becomes more brown in color. Then in the case of our patient in the LP, she is having poor vision, which is a blurry vision in her right eye, which is the reason why she was diagnosed with cataracts.
For the medical or surgical intervention, we have the medical management. Non-surgical treatment cures cataracts or prevent age-related cataracts. For the pharmacologic therapy, we have the medications administered pre- and post-operative are the dilating drops. Dilating drops are administered every 10 minutes for 4 doses at least 1 hour before surgery. Second pharmacologic therapy is the antibiotic drugs. Antibiotic drugs may be administered prophylactically to prevent post-operatively infection and inflammation. Third is the intravenous sedation. Sedation may be used to minimize anxiety and discomfort before surgery. We have the surgical management. The common surgical procedures done to correct cataracts. We have the lens replacement. There are 3 lens replacement options. First is the phacoemulsification. A portion of the anterior capsule is removed, allowing extraction of the lens nucleus and cortex, while the posterior capsule and zonular support are left intact. We have the aphakic glasses. In aphakic glasses, objects are magnified by 25%, making them appear closer than they are. We have also the contact lenses. Contact lenses provided patients with almost normal vision, but because contact lenses need to be removed occasionally. We have the IOL implants. The most common IOL is the single focus lens or monofocal IOL that cannot alter the visual shape. We have the extracapsular cataract extraction. It removes the anterior lens and cortex, leaving the posterior capsule intact. Second is the intracapsular cataract extraction. This procedure removes the entire lens within the intact capsule. We have here the assessment and diagnostic tests. For the decreased visual acuity is directly proportional to cataract density. First is Snellen visual acuity test. The Snellen visual acuity test measures the degree of visual acuity in the patient. Next is the ophthalmoscopy. Ophthalmoscopy is used to view the extent of cataract. And the last is the slit lamp biomicroscopic examination. This procedure is used to establish the degree of cataract formation.
Prevention of cataracts. One is quit smoking. The patient should avoid smoking because it is one of the greatest contributing factors to cataracts. Then the second one is wearing of sunglasses. Wearing of sunglasses shields the eye from too much exposure to UV rays that predisposes to cataracts.
For the complications, we have the potential complications following cataract surgery includes the retrobulbar hemorrhage. It can result from retrobulbar infiltration of anesthetic agents if the short ciliary artery is located by the injection. Next is the acute bacterial endophthalmitis. It is a devastating complication that occurs in about 1 in 1,000 cases. Last is the toxic anterior segment syndrome. It is not infection inflammation that is the complication of anterior chamber surgery.
Classifications of cataracts. The three most common types of senile cataracts are defined by their locations in the lens. For example, we have the nuclear cataract. A nuclear cataract is caused by central opacity in the lens and has a substantial genetic component. And we also have the cortical cataract. The cortical cataract involves the anterior, the posterior, or the equatorial cortex of the lens. And lastly, we have the posterior subcapsular cataract. Posterior subcapsular cataracts occur in front of the posterior capsule.
Next, we have the glaucoma. For the description of the disease, glaucoma is a group of eye conditions that damage the optic nerve, the health of which is vital for good vision.
Classifications of glaucoma. There are several types of glaucoma. Forms of glaucoma are identified as 1. Wide-angle glaucoma, narrow-angle glaucoma, congenital glaucoma, and glaucoma associated with other conditions such as developmental anomalies or corticosteroid use. Then we also have a causes of glaucoma. One is family history, hereditary predisposition to glaucoma, underlying conditions such as diabetes or high blood pressure. We have also regular use of certain medications including steroids, eye injury or trauma, thin corneas, and extreme nearsightedness.
We have the medical or surgical interventions. This is the pilocarpine in combination with the CAI reduces the IOP effectively. Clinical features or manifestations for glaucoma. We have the eye pain or pressure. Next is the headaches, rainbow-colored halos around the lights, then low vision, then blurred vision, and narrowed vision or blind spots. We have also the nausea and vomiting, and then the red eyes. For the surgical intervention, first we have the laser surgery, then the electrocautery, then the drainage implant surgery, and express mini shunt. Next is the AMP glaucoma valve, and last is the contact transmeral laser cryoablation.